I'm washing my hand as per CDC guideline. Hi, how are you? My name is Amalola and I'm going to be your nurse today. Can you tell me your name and date of birth?
4/2000.
Okay, do you have any allergy?
No.
On a scale of 1 to 10, 1 being the lowest and 10 being the highest, can you tell me the level of your pain?
No pain.
The patient reports no pain. If there was pain, I will reassess using the old cards. The PCT did your test, your vitals earlier, and everything was intact. She also used the Sinelli chart to check your eyesight, checking for visual acuity, which is cranial nerve 2, and the result is 20/20, which is perfect. I'm going to ask you some further questions. Do you know where you are?
Yes, we do.
Do you know why you're here?
Assessment.
Do you know what day of the week it is?
Tuesday.
Okay, the patient is alert and oriented ×4. Now I'm going to start the physical assessment. I'm going to start from your head and work my way down to your leg. If you feel uncomfortable at any time, just let me know. Now I'm going to start with your head. There's no lesion, there's no scar. Do you feel any tenderness? There's no tenderness. The skin on the face is intact. There's no jaundice, there's no pallor. Now I'm going to check your ear. There's no drainage or redness. There's no drainage or redness. Can you raise your head? Now I'm checking your nose. There's no discharge or discoloration. The spectrum is also midline. Can you say ah?
Ah.
Okay, your teeth are intact. Now I'm going to be assessing your lymph node, pre-auricular, post-auricular, occipital, retropharyngeal, anterior cervical chain, posterior cervical, supraclavicular, submandibular, submental. There's no lymph node palpable. Now I'm checking the trachea. The trachea is midline. I'm going to auscultate. I'm going to palpate for the thyroid. Thyroid is non-palpable and there's no swelling noted. Now I'm going to check the carotid artery. Okay, I'm going to check the carotid artery on both sides. I'm also checking for the jugular distension. No jugular distension noted. No jugular distension noted. Now I'm going to listen to your carotid artery compared to your radial pulse. I'm going to use the bell of my stethoscope. Okay, that's perfect. It's symmetrical. Now I'm going to be assessing the 12th cranial nerve. Can you close one side of your nose? What smell is this?
Peppermint.
Okay, that's fine. Now I'm going to be assessing the cranial nerve 3, 4, and 6. I'm going to flash my light to your eyes. Okay, the pupil is round and equal. Look at my pen. Okay, accommodation is present. Now I'm going to check for the cardinal gaze, 6 cardinal gaze. Can you look at my pen? Okay, there's no nystagmus present. Now I'm going to be assessing the cranial nerve 5. Can you close your eyes? Do you feel my hand around your face? Okay, that's perfect. Now I'm checking for the TMJ. Open your mouth. Okay, TMJ is smooth. Now I'm checking for cranial nerve 7. Can you raise your eyebrow? Can you smile? Can you frown? Can you puff out your cheek? Okay, that's fine. Now I'm going to be checking for cranial nerve 8. Can you close one side of your ear? Okay. I'm going to whisper to the other side. Okay, that's fine. Can you stand up? Close your eyes. There's no swerving. Can you face the other side and walk? Come back. Okay, gait and balance is perfect. Now I'm going to be assessing the cranial nerve 9 and 10, which is gag reflex and swallow. Can you swallow for me? Thank you. Open your mouth. Okay, gag reflex is intact. Can you raise your shoulder? I'm testing for cranial nerve 11. Okay, can you raise your shoulder against my hand? Okay, that's fine. Can you turn to this side? Okay, I'm testing for the trapezius muscle. Can you turn to the other side? Okay, that's perfect. Now I'm testing for cranial nerve 12. Can you stick out your tongue from side to side? Open your mouth and stick your tongue from side to side. Okay, that's perfect. Now I'm going to check for the upper motor neuron. Can you do this? Okay, that's fine. Now I'm checking for the lower motor neuron. Can you do the heel to shin on both sides? On the other side? Okay, thank you. Now I'm going to be assessing the chest and the arm. Now I'm assessing your skin on bare skin. Okay, the color is perfect. The temperature is warm and moist. Now I'm checking for tuga. There's no tensing present. Can you raise your hand for me? Up, down. Can you put your hand to the side? Can you bring your hand forward? Can you push against my hand? Can you push against my hand? Can you hold my hand as strong as you can? Okay, muscle strength is perfect and symmetrical. I'm checking for the capillary reflex. Capillary reflex is less than 3. Now I'm going to be checking for the radial pulse. Radial pulse is symmetrical. Now I'm checking for the brachial pulse. Brachial pulse is symmetrical. Now I'm going to be checking for the reflex. Can you raise your hand? I'm checking for the brachial reflex. Okay, now I'm checking for the biceps. Now I'm checking the triceps. Okay, that's perfect. Then I will assess the same thing on both sides to check for symmetry. That's okay. Now I'm going to be listening to your heart and lung sound. I'm also assessing your heart and your chest on bare skin, and the skin is okay. There's no pallor or jaundice noted. I'm going to start from the apical aortic valve, which is second intercostal right sternum border. Now I'm assessing the second intercostal left sternum border, pulmonic. Now I'm assessing the Erb's point, third intercostal space, left sternum border. Now I'm assessing the tricuspid, fourth intercostal space, left sternum border. I'm assessing the mitral valve, fifth intercostal, mid-clavicular. Can you move forward? I'm going to listen to the apical pulse for 1 minute. Okay, that's perfect. Now, I'm also going to be listening to your lung sound. I'm going to listen lateral and then the lateral on the other side. Okay. Thoracic cage is perfect. The heart, the lung sound is unlabored. And I'm going to assess the respiratory expansion. Okay, respiratory expansion is perfect. Now I'm going to go to the back. I'm going to assess the posterior respiratory expansion. Okay, it's symmetrical. Now I'm going to listen to your posterior lung sound. Lung sound is perfect and unlabeled. There's no wheezing or abnormal sound, no broad sound, no abnormal sound found. Now I'm going to move to your abdomen. The skin on the abdomen, I'm assessing it on bare skin. It's perfect. There's no sign of discoloration. The stomach is round. Can you lean backward for me? Okay, that's fine. When was your last bowel movement? Okay, did you notice any discoloration, pain, or smell? Okay, that's fine. Now I'm going to auscultate your bowel sound starting from the right lower quadrant, and I'll work my way up. Now moving to the left upper quadrant. Okay. Now I'm going to percuss starting from the right lower quadrant. I'm percussing on the left upper quadrant, then the left lower quadrant. Now I'm going to palpate. If you feel any pain, let me know. Okay, that's fine. Bowel sound is perfect. Now I'm going to move to the lower extremities. The skin color is perfect. There's no scarring or bruises. Now I'm going to check for the temperature. The temperature is warm and moist symmetrically. Now I'm going to check for edema. There's no edema on both sides. Now I'm checking for the pulse, the dorsalis pedis on both sides. Okay, that's perfect. Now I'm going to check for the posterior pedialis. The posterior pedialis. Okay. Now I'm going to check for the capillary refill. It's less than 3 seconds. Okay, I'm going to check your patellar reflexes. Okay. Can you raise your leg for me? Can you push down against my hand? Okay. Can you push against my hand? Okay. All right, thank you. Put your legs down. Do you have any question for me? Okay, that will be all. Thank you.